Neural tube defects, NTDs. Neural tube defects are serious birth defects that occur when the neural tube, a structure in a developing embryo that eventually forms the brain, spinal cord, and surrounding tissues, fails to close completely during early development. This closure usually occurs by the 28th day of pregnancy, often before a woman knows she is pregnant. NTDs can lead to significant disability or death depending on the severity and location of the defect. Types of neural tube defects. 1. Spina bifida. The most common type of NTD, spina bifida, occurs when the backbone and membranes around the spinal cord do not close properly. Subtypes. Spina bifida occulta. A mild form where the spinal cord and surrounding structures remain inside the body, but the backbones fail to close completely, often asymptomatic. Meningocele. The protective membranes around the spinal cord push out through the spine, but the spinal cord remains in place. Myelomeningocele, the most severe form, where both the spinal cord and membranes protrude through an open area in the spine, leading to nerve damage and disability. 2. Anencephaly, a fatal condition where the brain and skull do not develop properly. Infants with anencephaly are often stillborn or die shortly after birth. 3. Encephalocele, a rare condition where a portion of the brain and membranes protrude through an opening in the skull, often covered by skin or membranes. Causes and risk factors. The exact cause of NTDs is not fully understood, but it involves a combination of genetic, nutritional, and environmental factors. 1. Folic acid deficiency, insufficient folic acid, vitamin B9. Intake before and during early pregnancy is a major risk factor. 2. Genetic factors. A family history of NTDs increases the likelihood of recurrence. 3. Maternal health conditions. Diabetes, obesity, or certain medications, like anti-seizure drugs, can elevate risk. 4. Environmental exposures. Exposure to high heat, fever, or saunas during early pregnancy, or specific toxins. 5. Ethnicity and geography. Some ethnic groups and regions show higher rates of NTDs. Diagnosis. 1. Prenatal screening. Maternal serum alpha-fetoprotein, MSAFP test. High levels of AFP in the mother's blood may indicate an NTD. Ultrasound can detect physical abnormalities in the brain or spine. Amniocentesis checks for elevated AFP and other markers in amniotic fluid. 2. Postnatal diagnosis. Physical examination and imaging tests like X-rays, MRI, or CT scans confirm the diagnosis after birth. HAD prevention. 1. Folic acid supplementation. Women of childbearing age should take at least 400 micrograms of folic acid daily before conception and during the first trimester. 2. Healthy lifestyle. Maintain a balanced diet, manage chronic conditions, and avoid harmful substances during pregnancy. 3. Genetic counseling. Recommended for families with a history of NTDs. Treatment and management. Treatment depends on the type and severity of the defect. 1. Surgical interventions. Prenatal surgery for spina bifida can improve outcomes in some cases. Postnatal surgery to close the defect or correct complications like hydrocephalus. 2. Supportive care. Physical therapy, occupational therapy, and assistive devices help manage long-term disabilities. 3. Multidisciplinary care. Regular follow-ups with specialists such as neurologists, urologists, and orthopedic surgeons. Prognosis. The prognosis varies widely depending on the severity and type of defect. Mild cases, e.g. spina bifida occulta, minimal impact on quality of life. Severe cases, e.g. anencephaly, typically fatal. Early intervention and supportive care can improve quality of life and functional outcomes. Understanding the importance of early prevention and maternal health is crucial in reducing the incidence of NTDs.